Good afternoon, everyone. We're so glad to have you join us. I am Dan Worry, the Director of Early Learning at the Hunt Institute, and welcome to the third episode of our Early Efforts, Early Childhood Philanthropy series. We're so glad to be with you and to have a great panel today. As we get started, I want to introduce you to the Hunt Institute's President and CEO, Javed Siddiqui, for some opening remarks. Javed? Javed, you're muted.
Sorry about that. Thank you, Dan. Good afternoon, everybody. Thanks for making time to be with us. This is our third installment of our very popular Early Effort series. I would like to thank our panelists for making time to be with us. Today's conversation will focus on strategies and tactics we should be considering to certainly protect our investments in early education, but push harder for more. This is a time to push for more. This pandemic, coupled with the social unrest, has shined an even brighter light on what many of us already knew and know. If we truly want to level the playing field, we need to focus more time and energy and resources with expecting moms, infants, and toddlers, and certainly our 3 and 4-year-old learners. I know our panelists are going to push our thinking and on this continued fight for racial equity and the role early learning plays in that. So with that, I'm going to turn it back to Dan to get our conversation going. Thanks so much.
Terrific. Thank you so much, Javed. As I mentioned, we have a wonderful panel today. I want to introduce you to each of the 3. Dr. Marquita Davis is the Deputy Director for Early Learning at the Bill and Melinda Gates Foundation. Isabel Howe is a partner at Imaginable Futures. And Dr. Elizabeth Bruno is president of the Brady Education Foundation in Chapel Hill, North Carolina. So all 3 of you, we are so glad to have you, and we're going to go ahead and sort of kick this conversation off. You know, as Javed mentioned, we began this series very much in the context of what is early childhood philanthropy thinking about during a global pandemic? As is no secret to you or to anybody watching, we've had a variety of crises in this country related not only to the pandemic, but certainly a reckoning on justice and racial equity right now. We have a very contentious national election cycle underway. And so it's an unusual time. And we wanted to kick this conversation off by giving you a little bit of an opportunity to talk and reflect on what you and your foundations are exploring and re-examining and maybe even doing differently during this time, and what, if any, insights you have gleaned in this process. So with that, Dr. Marquita Davis from the Bill and Melinda Gates Foundation, why don't we kick things over to you for some opening comments?
Thank you so much, Dan, and I appreciate the opportunity to have this conversation. I'm actually going to start selfishly with me and the way that I'm thinking about COVID and the impact that it has on racial disparities. And, I actually am tired and feel a deep sense of sorrow and feel overwhelmed. And I think that I have to be authentic in how I feel and how I show up in the work. This is a field that I'm passionate about. And so even with the state of how things are and this sense of being tired and overwhelmed, I also feel a great sense of urgency. And so the way I think COVID has impacted how I think about the work is that this urgency has to be translated into some real action. And so at the foundation, our focus in the past has been on actually what I believe is a great push towards equity, and that is essentially providing quality early learning experiences for Black and Brown children and those children experiencing poverty. And so I believe that now, given COVID, given what we understand is happening to kids that are marginalized in the absence of being in the care of caretakers and providers, is that while many of the work of the foundation is to focus on these systems impact and how we change systems, that in the intermediate time or the short-term time, we have to focus on those real goals that help create change for the short term. How do we address these specific needs of kids where they are? And right now, where many of them are at home with their families. And so how do we support families? How do we support children? How do we support teachers? How do we think about scaling solutions that actually have outcomes for people in place? And then how do those scalable solutions translate into outcomes, given that our ultimate goal is still about impact and systems change? So the last thing that I want to say is that COVID has just really, in my opinion, highlighted what we already know is happening in this country. And what we know is happening with poor children, Black and brown children in particular. It has highlighted it in a way that we cannot deny, look away, create excuses for it. And so what the field does to address their needs, what funders do to support the field, it's so important. And we've got to ensure that we have people at the table that are part of the solution and driving change. Thanks.
Marquita, thank you so much, and we look forward to sort of unpacking some of those ideas over the course of the next hour. Isabel Howe of Imaginable Futures is next on our agenda. Isabel, you want to talk a little bit about your thinking during this time and what Imaginable Futures is maybe reconsidering or doing differently?
Yeah, COVID for us has really transformed a lot of our activities at 3 levels, if I may put a little bit of a framework: the how, the what, and for whom. On the how, at the onset of COVID, we did something that we had not done before, which is really funding into communities and childcare in particular. So accelerated our funding streams in ways that were really unprecedented for us. On the how, we also are spending a lot more time than we have ever had at the combination of the Media Network and Imaginable Futures, which is on policy. There are unprecedented windows that are opening up on policy. And so as Philanthropy, spending a lot more time on advocacy and policy. On the what, we are doubling down on home-based childcare, which is an area where we were already spending a lot of time in, but it's a clear need in this crisis. Parents want care either close to home in smaller settings, because of the safety and health-related issues. And this is a sector that unfortunately has been decimated by the crisis. So spending a lot of time on shoring and helping this area of the early childhood field. We are also spending a lot more time on the what on mental health. And generally, more broadly, intersectionalities between education and other areas that pertain to someone's life. And then for whom, we also have always been focused on equity, but I would say our lens was more income equity. And we are recentering a lot of our work on racial equity and justice. And I see this as a beautiful thing that the crisis is creating for our work.
Isabel, thank you. And let's turn things over to Liz Brito from the Brady Education Foundation in Chapel Hill.
Thanks, Dan, and thanks for your leadership on this issue and for allowing me to participate today. So the Brady Education Foundation, our mission is to close the educational opportunity gaps that are associated with race and income. We do this by promoting collaborations among researchers, educators, other stakeholders, by funding research and funding program evaluations with the hopes of informing philanthropic giving and public policy. And so frankly, when this all hit and we all went home immediately, to be completely honest, we were unsure how to respond. We fund research. We don't fund operational support for nonprofits. We don't fund basic needs. And I just watched in awe and great admiration with the work, like my colleagues today are talking about, how they just pivoted so quickly and just provided all this support. And then it dawned on us, yo, we need data today more than ever. We need data to instantly know as fast as we can what are the differential impacts of this pandemic, so that we can be informing all of this work that's happening right now, all of this work that's happening in terms of policies and practices that we're trying to put in place to address this, so we can know as quickly as possible what's working so we can do more of it, what's not working so we can try to figure out why and try to adjust. But that required us to do some real big changes in ourselves. So here's our typical funding process. Our board meets 3 times a year. We have a 2-stage funding process with board review at each stage. So it's typically 9 months between that first application being submitted and when funding actually begins. That wasn't going to work. Imagine where we all were 9 months ago, right? I mean, that's not going to work. So we really had to change our processes. And now, instead of giving grants in months, we're doing it in weeks. I mean, it really has changed how we're working. And a lot of that is because, and to echo what's been said, you know, this is a moment in time. Now, we in the early education field, we have recognized these disparities for a long time. I mean, think about all those equity efforts that were going on for years before all of this hit. I mean, this is something we've been talking about. But I'm also feeling a big sense of urgency in this moment because, you know, this is a time people are listening more than ever before. The overt pushback, we know there's still covert pushback, but the overt pushback is just, it's not as strong. And so I'm really looking at this moment in time as a time to really, you know, create a strong foundation for the next phase of the work. We know national attention is going to shift again. We're all going to need to be doing this work without so much attention again, but to really take advantage of this moment in the larger movement to create real change to set the stage for the next phase of the work.
Liz, thank you. I want to invite those of you who are participating today to get in on the conversation. We have a chat function here in Zoom, obviously, and a Q&A function there. If you have questions for our panelists, we'd like to devote a significant chunk of our time together today to hearing from you and to asking your questions. So we invite you to enter them into the chat. I will warn our panelists, I've had a little bit of outreach with those who were registered already this morning. So we actually have quite a list of questions. We probably have enough questions for about 4 webinars. So what we'll do is that I'm gonna begin with one round of questions, and then we will go to a combination of audience questions that have been submitted by email and those that are in the chat. But please, if you have a question as we're going, do feel free to enter it in there, and we'll just do our very best to get to as many questions during the hour we have together today as possible. On that note, I want to mention to you in advance that, you know, recognizing that we probably won't make it to every question today, that we do have one more bite at the apple, which is that all 3 of our wonderful panelists today have agreed we're going to be circling back up at 11:45 a.m. on Thursday for a short Twitter town hall where we'll have an opportunity to pose maybe a few more questions via social media. And in this case, Liz has even created a Twitter account for the first time. So we've dragged her kicking and screaming into the Twitter era. We're so glad to have you there. So I'm going to start with one round of questions, and then we'll go directly into those audience questions. And Marquita, wanted to circle back and start with you. I know the Gates Foundation has done a lot of work to ensure the availability, as you mentioned, of high quality pre-K, you know, especially within Tennessee and Washington and Oregon as focus states. But you know, as in other areas right now, the pandemic seems to be having the effect of kind of rolling back some existing pre-K access. I've been reading recently in states like Virginia and Nevada, we are seeing stories of local school districts that are actually paring back pre-K in an effort to ensure smaller group sizes and social distancing in the primary grades. So because they're trying to spread those kids out, pre-K has been on the chopping block. In addition to that, we know that state revenues are in a period of very steep decline right now, and so it has prevented not only there had been historic announcements about pre-K expansion already anticipated in California and Virginia and South Carolina, and I think some other states as well that are now kind of on hold. But a real question right now about cuts even to existing pre-K access. So wanted to start the conversation by just sort of posing to you this question of what specific equity concerns and challenges are you seeing unfold for young children right now during the pandemic, and what role do you see philanthropy playing in holding those challenges up to the light and helping to address them?
Yes, thank you. So when we are talking about the population that we're concerned about, Black children, Latinx children, and children experiencing poverty, we already recognize that these children are living in communities where there are food deserts, communities where there could be substantial or inadequate housing. They're going into public school systems that also may not receive the adequate amount of funding. So we already know that these kids are at a disadvantage. Part of the equity push for the foundation is to ensure that children prior to entering the kindergarten K-12 experience have access to quality early learning experiences. And with the cuts in funding and the gains that we have made in states, we're deeply concerned because these are the kids that will experience the implications of funding reductions more than most kids. And so as we are thinking about these two opposing spaces, like everyone is focused on the need for childcare. I think that is extremely important. But childcare, quality childcare is important for all children, but particularly for the children that we care about. So even at the policy level, if the emphasis is if the emphasis is to fund childcare at a greater level, our push still is that if that is the case, it must be quality. It has to be quality for the kids that we care about, because these are the kids that do not live in these environments that guarantee them the access to quality beyond these childcare experiences, beyond the pre-K experiences. And so on the opposite side of the push is that we are reducing funding so we can have fewer kids in classrooms and the public school environments. I get that. But again, in the communities that we care about, many of these public school environments are inadequate. And so again, we have to push back against that notion. And what we are trying to do in states where we built the capacity, where we're helping the infrastructure, is, as Isabel said, our play has to be a deeper policy play. We are not going to say that access and seats and slots aren't important, but we will continue to push on quality, how we can ensure quality for the kids that we care about. And then there's one other thing that I think that I really need to talk about is that remember that these are the kids that are experiencing trauma. And so they are living in environments where, because of the pressure of COVID on their families, like losing jobs, the feeling of isolation, the children that we care about are exposed to abuse, greater incidences of abuse and neglect because of the dynamic of COVID. And so while we are pushing for more slots in childcare, we understand that the kids that we care about really need to be in those seats. And so I believe in the whole continuum of care. I don't think kids just pop out at 3 and 4 and then start pre-K. They begin this journey from birth. And so we are trying to make the policy pushes and plays that have great implications for the kids that we care about, while acknowledging that there are going to be cuts at the state level. We are just trying to figure out how we can shore up state agencies and Head Start programs and quality childcare programs to ensure that the kids that we care about continue to get the appropriate services. We can't abandon this equity charge. We can't. It is a moral imperative. And so we are going to continue to push and have voice and demand that these kids have quality experiences.
Marquita, thank you.
Mm-hmm.
Isabel, I want to turn to you, and one of the things that has been interesting, we've had lots of these conversations, and during such a serious time, obviously there are lots of concerns to raise. But I've been looking forward to talking to you because I have been thinking that maybe there's a hopeful note here as well amidst the pandemic. The work of Imaginable Futures is so interesting and kind of unique in the sense that you are partly a philanthropy, but partly an impact investor, right? So your portfolio has been focused on accelerating innovation in the early childhood space. And we know that, very frequently major disruptions can really be ripe for innovations that might have been hard to come about otherwise. So I'm wondering what, if any, silver linings maybe you and your grantees are finding during this unusual time, and whether there is any sort of innovation that you feel like is thriving in early childhood right now that might persist after we're through with this period of the pandemic.
Yeah, thank you. I think there is one big overarching silver lining in this crisis, and in any crisis, by the way, which is greater collaboration between unusual suspects. And that has been, for me, for my team, for all of us in the field, a source of hope and a way to find positive energy in very, very challenging times. And I have multiple examples, but starting, for example, with childcare networks, where at the onset of COVID, various communities and states realized the need to provide childcare for essential workers, and realized that there, in a lot of places, the data systems were not adequately serving the needs to identify where the needs were and match supply and demand effectively. So we saw some really interesting investments in data infrastructure. Certainly in California, this was the case, but in many other places, Vermont, Texas, Colorado come to mind straight away. Many communities made those investments to do this matching of supply and demand early on. And they did this in beautiful private to public partnerships, so involving the private sector in doing so. And I believe that those data infrastructure investments will be there to stay and will continue driving really good things in the future once a crisis is over. So that's one area that for me has been really interesting. Another area is workforce. I was part last week of a phenomenal event that our friends at Head Start organized on the future of professional development in the workforce. So not focused on compensation, which is a huge issue by itself, but really focused about how can we bring new ideas regarding credentialing, competency-based education. How can we think about more apprenticeship programs, and a number of other ideas that were discussed. And I also think that this crisis, because of all the issues in higher education, the early childhood fields, these two fields are effectively coming together to say, how can we do things differently together? And so those two examples to me, public to private, as well as greater collaboration between different age groups in the education field, are really, really interesting and signals of hope and new opportunities.
Terrific. Thank you, Isabel. And Liz, want to turn to you. And you already referenced the question of data and research. And I know that this is a time, because you and I have talked about this many times now, that there is that this is a time that things are moving so quickly with this pandemic situation that the kinds of data that we often wish that we had are often in very short supply. If for no other, I mean, there's not a mechanism necessarily to collect them, or at least wasn't, at the beginning of this conversation. And things are evolving so rapidly that it feels like day to day, there are new questions that we wish we had more data on. So talk to us a little bit more, if you would, about the value of philanthropy investing in research, and what are the pressing questions that you'd really like to see answered as we address, not only the pandemic, but some of the equity questions that it has raised.
Okay, so I will try to do this briefly, because I could talk about this for 5 hours, and I promise not to do that to you. But, just to belabor the point for a second, we need research for many reasons. We need to, number one, understand what we're facing. We know that there are these disparities. Well, we need to really understand that, so that number two, we know how to deploy our resources, how much resources we're going to need and how to deploy them. And then number three, how we can hold ourselves accountable. So once we've deployed those resources, we need research to then tell us, did we address those gaps? Did we address those disparities? If not, why not? If so, scale up, do it more. So I just want to make 2 points that are kind of in general, both in terms of the short-term, quick turnaround research that we need right now, but also long-term that gets at some of those questions about quality that Marquita talked about before as well. So 2 points I want to make. One, everybody talks about all the time, is talking about the kind of data that we need to collect. But then two, I want to talk about who we need to support to do this data and why philanthropy needs to be investing this way. In terms of what we collect, we need to make sure in everything that we support that we're going to be able to disaggregate by race. Lots of people talk about this. This is not a new concept. Let's just stop arguing about it. Let's just do it. Without that, we won't be able to know where to put our resources and to hold ourselves accountable. So number one, disaggregate by race. Number two, though, is we really need to think about who we're supporting to do this work. Frankly, our field is based on some really important seminal studies that had great impacts in terms of telling us, we need to invest in early education. They can have long-term impacts in terms of health, education, occupation. But a lot of those early seminal studies were done by all white researchers. And frankly, those early seminal studies, a lot of them are racist. So while we were able to get some really good data on terms of, basics in terms of safety and care, there's still a lot of questions that we need to answer about quality. Really, what is quality? That research, they were based on deficit models. They were looking at communities and saying, oh, well, we're not seeing those practices that we see in these white communities that are promoting development. So they're not there. So there's deficits. So we need to provide early education to be able to address those deficits. And when you walk in with those assumptions, and I know I did this research, I was part of it, okay? But when you walk in with those assumptions, it affects the questions that you ask. It affects the methods that you use. It affects the trust of your participants. And so the data that you're gonna get, how fully they're actually gonna participate with you. It affects the interpretation, it affects how you interpret your data, thus what policies and what practices you're gonna recommend that need to be implemented. And when you do research that's based on racist assumptions, you're gonna promote racist policies. And how do we know? Because we look at the disparities in the outcomes. So we need to promote more and more of this research. Now, what's really exciting is that there has been some great research that's been going on that is looking, using a strength-based approach. And I'd love to talk about it if we have time. If not, email me online. on Twitter now. So I will tell you on Twitter some examples of some of this work that we're funding that's really helping to inform these great strengths that are developing in diverse communities that early environments can capitalize on, and how we can capitalize on them to promote success. So one of the things that we've done as a foundation, having to look in the mirror, is we now require that all projects that focus on communities of color, which frankly is a lot of what we do given our mission, must have researchers of color in the leadership team. So it's not just what we fund and what we make sure, but it's who we fund. Yeah, I mean, we're still learning, okay? So I'm not saying that we're in the end, and we're still paying attention, and we're flying this plane and building it at the same time as so many people are saying, but we just recognize that we need to be doing things differently, and that's one of the things that we're doing, so that we're able to get the data that we need to really inform how we use our resources. Thanks.
Very well said. Thank you, Liz. We're going to move at this point to some of the questions that have been submitted by the audience. I see we've got a few coming through in the chat, and we've got a good list of them that have been offered by those of you in the audience earlier in the day. I wanted to ask all of you on the question of COVID. An interesting thought here submitted that there's an immediate impact on COVID-19, which we've been talking about a lot. The impact on early childhood providers, the manner in which we're providing services right now. But I think important to recognize that the pandemic is likely to have long-term impacts on children and families as well, on things like social and emotional development, on mental illness potentially, on increases in children's experiences with trauma during this time. So just as to any and or all of you, what strategies have you all been considering in terms of addressing the long-term impacts of the pandemic?
I'll jump in real quick, because I think I mentioned it in the other, in the most recent response. So if we already understand that kids entering into kindergarten, that what we're trying to do is close an achievement gap, can you imagine the implications of COVID-19 on that achievement gap? They're already large. They're going to be substantially larger. So how do we, this is Liz's territory, how do we measure, like a summative measurement at the end of an early learning experience? How do we measure where kids actually are as they enter kindergarten, so we can help the K-12 system and kindergarten teachers design and work with kids exactly where they are, or to have some understanding that from the time they left that preschool experience to how they show up in kindergarten, whether they're administering another type of kindergarten readiness assessment, here's what we learned, here's how you must adjust, here's where they are. And so if this is a summative assessment that's not only academic, but social emotional, has some elements of kids experiencing trauma, we'll have a better understanding of the deficits, where kids, as a benchmark, we can use data prior to COVID. We really, in this instance, if we are thinking about long-term outcomes for kids, we have to have a benchmark. We have to look at the most recent data, and we have to use it as the measurement of how we think about progress and understanding kids moving forward. We've got to be able to use that data to inform how we work with kids as they enter the system. We can't just talk about these gaps without, to Liz's point, she'll be proud, without having some real data to know how to adjust the learning to respond to their immediate needs.
Yeah, we studied the impact of prior crisis, and there's a lot of good research on Katrina and other disasters, and the impact on greater inequities is very, very clear. It's long term. It impacts more the younger ones. It impacts, it's not gender neutral, so it impacts more girls. It also has meaningfully more negative impact on children who had already signs of vulnerability in their prior experiences. And so we have been looking at how could we make more investments in trauma-informed care at this time, mental health more broadly. Some of the organizations that we work with have already done some great work in those areas. I'm thinking our portfolio organization, Parent Powered, that is in the family engagement space, has now a trauma-informed care program, which is quite simple, delivered through text messages to families, which is quite a nice platform for reaching out to families in a reasonably ubiquitous way, given that you don't need broadband access to get the messages. But we are this is just one example. Trauma-informed care is an area of great interest and one where we believe there is a great need to, given what we know about the not likelihood, but the inevitable rise in inequities, addressing trauma is a huge area of need and investment that we are focused on.
Liz, anything you wanted to add on that?
Just yay data. But just to underline the point, thank you, Marquita, that we really need to be assessing these kids in a wide variety of areas. It's not just tell me how many numbers you can count, tell me how many letters you know, right? I mean, but we also need to make sure that we're using measures that have been validated for the right populations, and that we're not using measures that are going to not give us the accurate data. We need the real data that we need. We need to know that they're validated on the right population so we can make real decisions. And we need to keep getting this data, not to, not over testing, not punishing, kids and teachers, but so that we can really be assessing as we're putting in these interventions, as we're trying to address these needs to help kids be successful. Are they being effective? So we're not wasting more years, doing things that aren't effective. And when we find things that are, we do more of them. So yay, more data to inform how we move forward. I'm sounding like a broken record. I'm sorry.
That's our theme for the day is yay, data.
Dan, can I add one
Please.
quick thing to Liz's point and also to Isabel's point? It's yay data, but data cannot be in the absence of lived experiences for these kids as they're experiencing trauma. We cannot disentangle the two, especially if we really care about long-term effects of this pandemic and these lived experiences. So I just wanted to add that.
Amen. Lived experiences are data. Those count too.
She's making everything data, so I'm good with that.
Let me transition you to sort of a maybe not specifically COVID related question, but that maybe continues this conversation on data. In fact, we mentioned at the outset here, this is the third one of these philanthropy conversations we've held. I've been surprised that this question hasn't been asked at every one of these convening. So I wanted to ask you a little bit of a general question that I think is of a lot of interest to a lot of the people who are tuning into these conversations. And that is, what advice would you give to a new early learning nonprofit in terms of connecting with the philanthropic community? Obviously, there is an interest in connecting with you all as funders. And the related question that they had asked was, what kinds of data and program outcomes do you use to determine the impact and the success, maybe not only of your current grantees, but of prospective grantees? Anyone, jump in. You're all muted.
Isabel, go, because I've been talking. Go.
Maybe to start with the last question first, and then come back to the former one. We have we are trying to connect our portfolio with data from a big national outcome measure called Healthy and Ready to Learn, which is effectively an attempt to measure nationally child well-being for 3, 4, and 5-year-olds, which is a nice whole child approach across cognitive, social, emotional learning, physical and health, and emotional regulation. We are seeking to connect all our portfolio towards one of those 4 dimensions and across reach, depth, and influence of each organization toward those, this particular measure of child well-being. Then on the former question, my advice is very simple. It's, reach out. We are here to be in connection with new ideas, be persistent, but we are here to be in connection with new ideas and love connecting early. We can't fund all ideas, but we certainly think of ourselves as a connector of different ideas. So if we can't fund, we may be able to help find other funders that may be a better fit.
The one thing that I want to add, because I am, really interested in minority-serving organizations or more minority-led organizations that are often not at the table. And often they're not at the table because philanthropy hasn't made space for them at the table. So I think that there is a role for us to play in reaching out and engaging, and at least having them be part of the solutions that we come up with, right? But if you are looking to make connection with funders, the first thing is relationships matter. They matter. And to Isabel's point, be persistent about the relationship first. And then you need to talk about how you can partner, how you can show up and engage. Understand the strengths of your organization and understand how those strengths play into the field. Know what the funder is funding and how it connects to the work that you're doing. Don't adjust your work to meet what the funder is funding, because it will not come up authentic and you won't be able to measure it. And understand that there are funders that fund ideas and things that feel good, but many of us are looking at impact, something that we can fund that has long-term impact, that changes systems, and it has to be measurable. At the Bill and Melinda Gates Foundation, you think about our co-chairs and where they come from. And so that we are data-driven, like most organizations that fund. And so you have to approach this as, here's the data that I have to support the needs. And the last thing that I want to say is, we are looking at the causes, how you change the conditions. So if you say to someone, I need you to fund the Boys and Girls Club because they don't have any uniforms. We need you to think about the condition that brought the realization that they don't have uniforms. Is it poverty? Is it lack of this? And how you change that for the long term, so you don't have to keep coming back asking someone to fund an initiative. So that's what I would suggest.
Very well said. And Liz, I would imagine, Marquita mentioned it, but I mean, you as having a somewhat specialized focus on kind of the research and data pieces. I mean, I think that piece of advice that Marquita offered about really understanding who the funders are and what they fund gets you a long way toward not wasting your time on a disconnect between the two.
Absolutely, absolutely. And we're in the business of funding the work to help you get the data. So you have a program that you're like, hey, what we're doing is spot on. It is absolutely addressing these disparities. This is how we're promoting great outcomes. We know it, and we want to we want to help, our job as our foundation is to help you get the data that you need that will then inform these other funders. And so the way it works with us, and different funders who do research have different policies, but what we do is we fund the external evaluator. And so what we want is the program to be partnering with the external evaluator and developing the questions together to develop a really good collaboration. And then it is the external evaluator who will then come and talk to us. And that's how we do like program stuff. But we also fund some policy research, which we do in different ways, but it's really in collaboration and creating questions that will allow for this data to happen. So much of the innovation that happens is because practitioners and educators and policymakers are doing it. And so what we like to do is to partner with them to help them actually get the data that they need to understand those impacts that then can turn around and inform when they're going to Bill and Melinda, for example, and saying, hey, give us some money, Marquita, help us out. But to be able to have that evidence and to help them out. So that's the niche that we've decided to play in, because a lot of funders do fund the operations and there's not a lot of funding left over for the research part, and research done right costs a lot of money.
Good. Another kind of interesting offshoot to this. One of our viewers notes that frequently philanthropy plays a role in helping to get certain projects and innovation off the ground. But along with that comes a conversation sometimes around whose responsibility ultimately should it be to get some of these things up and running. So the question specifically is, how does philanthropy avoid doing what government should be doing and prevent being used as an example by government to justify why it isn't acting?
Yeah, I think about philanthropy as a risk capital. Dan, you had asked a question about COVID, but COVID is a really good example where at the onset of the crisis, what was the role of philanthropy, given that likely there would be some public funding for relief at some point, hopefully. Well, we're still waiting for those public dollars to come in many ways. So I'm glad that philanthropy stepped up. But generally, I think about philanthropy as risk capital, demonstration of what is possible, which if paired with data can then be scaled by public dollars.
Question again from the audience. Should we accelerate movement toward a comprehensive strategic approach to deploying early childhood philanthropy in partnership? If so, how would we deploy those philanthropic resources through sort of a collective effort that would be strategically aligned across the public and private sectors to achieve equitable and sustainable impact for all children? Thoughts there on philanthropy working collectively?
Well, there are examples where we're doing that. Some of the big bets in the collaboratives across that we were doing pre-COVID on work on the workforce, on health. So there are examples where funders are saying we are going to be aligned on collective agendas, and we are going to fund as a collaborative around these issues in the field. So we are in fact doing that. I'm going to say something provocative as Marquita. We always represent where we work, so I think that's a little loaded. But being part of this field, one of the hardest parts is to come up with that one thing that the early learning field can align themselves and line up with. And then, because even in the big bets and some of the decisions that we've made as funders, there are still people in the field saying, why not this instead of that? And so I think that the responsibility of the field also is to find a place where we can align, where we can push these big bets. I think workforce is a space that we can push around equity, particularly if we are concerned about the teachers that are teaching the kids that we care about and the credentials that they have. And most of the time that we see the kids we care about, Black and brown kids and low income kids and kids in general, in early learning, all kids, the teachers may not have the appropriate credentials, they may not be adequately prepared, but we want to see great gains and outcomes for kids. And so that is a place that we can push. And I think that our big bet on workforce is a good way in which we collaboratively as funders have decided to place our emphasis.
Good. Isabel or Liz, anything you want to add?
Yeah, no, another example is home-based childcare, where there is also we are part of a coalition of 11 philanthropic funders at this point to try to bring a new lens on quality and the feasibility of quality in home-based childcare environments through a combination of research, practices, and policy. So very interesting collaborative effort. I would also like to elevate the really terrific work of the Early Childhood Founder Collaborative is doing. A number of us are part of it. They have led literally weekly, if not multiple times a week, calls among all of us during the crisis to increase collaboration among founders. And they have a big effort ongoing right now on racial equity and justice that we are part of. So a lot of really good initiatives across the early childhood field. If anything, my concern is a little different. Is more, it's not about collaboration within the early childhood field, which I feel actually, if anything, is really strong relative to other sectors. It's more collaboration of not only making early childhood an effective system, but also collaboration of early childhood with other sectors and think bigger and more ambitiously. So those are maybe a little bit different concerns than the question that was asked, because I see a lot of collaboration within the early childhood field, but think it's maybe thinking, in some ways too small and too internally focused. Yeah.
I think you're right, Isabel.
Liz, anything you wanted to add there?
I was just going to hold up the efforts from the Early Childhood Funders Collaborative as well, and just mention that, the work that they're thinking about is this quick turnaround right now in the moment, but also the long term, and just thinking about how we understand quality better, how we understand, really what we need to be doing and implementing in early education. So still focused within.
Great. Well, we knew this hour was going to fly by, and sure enough, it has. But I think we do have one opportunity for a closing question for each of you. As we're looking ahead, philanthropy is often asked to sort of look at the big picture, look into the future, and anticipate our needs. What do you see as we look towards 2021 as maybe the greatest opportunities for creating a more just early childhood landscape that addresses some of the structural issues that we see today that have come up across all of these questions today?
I'm going to go because what I have to say is really simple. Gandhi said, "Whatever you do for me, without me, you do against me." And so if we want real equity and real change, we have to include the people that we care about at the table in creating solutions.
Wonderful. Isabel?
I have a more complicated answer than Markita, although I love your answer. I would like to see us invest earlier. I would like to have access to quality early childhood experiences become a human right. I would like us to not forget about quality. Markita and Liz, you spoke eloquently about this, but I'm very concerned as we are making a case that childcare is a way for people to go back to work, that we are forgetting the child and the quality of those environments. And then last but not least, support families in this process and think about intergenerational poverty and two-gen approaches as opposed to solely early childhood focused on the child.
Liz.
Gosh, how do I follow these two amazing women?
It's tough, I know.
So basically, just really quickly, surprise, research, and research at lots of different levels. So we need research at the policy level. So for example, the Children's Equity Project right now, and that report that just came out, we need research as those are implemented. We need research at the family level, like the work that you're doing, Dan, with us in terms of really understanding, talking to the state administrators about how access is even more challenged right now, and how we're ensuring that there's equitable access while we're dealing with reduced group sizes and social distancing. And then just on that one-on-one level, caregiver and child, whether it's the family or whether it's in a childhood setting, to really understand what are those interactions that are promoting those outcomes, and how we can be supporting children and families and the workforce. And so just thinking about research at all of those levels to inform what we're doing going forward.
Well, I knew from the moment we got these three together for a quick prep call that this was going to be an amazing hour. I feel like I need to get the three of you together more. At this point, what great friendships have formed here. So it is such a treat to have all three of you. Thank you so much for taking the time. I want to thank Dr. Marquita Davis, Deputy Director for Early Learning at the Bill and Melinda Gates Foundation, Isabel Howe, Partner at Imaginable Futures, and Dr. Elizabeth Bruno, who is the President of the Brady Education Foundation in Chapel Hill, North Carolina. Before we log off today, I want to tease to you that we have another great webinar coming up. If we can advance to the next slide, on Thursday, this Thursday, 2 p.m. Eastern, another in our Race and Education series, The Intersections Between Racism and Poverty and Education Policy. This promises to be a really fantastic discussion. If you have not yet registered, and you see our speakers there on the screen, definitely encourage you. The links to register are readily available through the Hunt Institute social media accounts. If you want to visit the Twitter account, it's at @Hunt_Institute, and you'll be able to find that registration information. And we would love to see you on Thursday, and I look forward to upcoming announcements. We've got several really fantastic early childhood focused convenings coming up before the end of the calendar year that I look forward to sharing with you here soon. So hope to see you then. Again, thanks to all of our panelists, and thanks to all of you for being with us today.